At our office, we've kept that kind of quiet because, as I found in Arizona, once got established as a foo-foo doctor, that people had a hard time making the connection that you could see us for strep throat and stitches and blood pressure and diabetes and all that kind of stuff. So, newborn exams
But you know what? As a
didn't fit
G,
with Botox.
really in GP, those things do all come together.
Yeah, especially with the additional training that I've had in dermatology. A lot of emphasis there in my training, but um, for about 5 years, I spoke as uh, a laser. They call it a luminary, but basically it's a speaker to other physicians about lasers and using cosmetics in your own practice. So this is not a new idea or something new that I just decided, hey, I'll pick this up and see how it goes. These are things that I have expertise in that I have kind of intentionally kept quiet. And so we've actually built a separate suite across the grass from where our main office is that is kind of our secret spa for those that want to do things and don't want everybody else to know where they're going. But we have some fun stuff. We have chemical peels, and we're going to do what's called a peel party towards the end of September, the 20th. It's a Thursday night, a Thursday afternoon night. That requires a $100 deposit because you're going to get about $300 worth of treatment that night. Plus, you'll learn a lot and you'll have a consultation that's personal between you and either myself or one of our providers. But for those of you that just want to kind of get to know what kinds of things are out there, we do what's called a seminar. And so this is cosmetics seminar. It is next week. It is September 5th. It's Wednesday evening at 7 p.m. We only have room for about 20, 25 people at a time, so please call and actually make a reservation for your spot. We've done these about every month or every other month over the last 6 months or 9 months, and almost every time they're just jam packed. And they're a lot of fun because I get to answer the questions you want to know about, whether it's brown spots that are showing up on your face, whether you think your skin is too rough, whether you have acne, whether you have some wrinkles you want to get rid of, and how to make that all happen without anybody else even knowing. This is very step by step, mild to moderate type of treatments. And they're a lot of fun because there's no real downtime and it's not, we really don't believe in the no pain, no gain principle. There's sometimes a little bit of prickly heat with some of the chemical peels, but this is not self torture. My wife's grandmother taught her the phrase that beauty knows no pain. That came from combing out her curly hair, and so we try not to live by that mantra. So come have some fun with us September 5th. But please call our office, and that is at 208 933 4400. That's 208 933 4400. And either sign up for the peel party on the 20th or at least for the seminar, come and get your feet wet, so to speak, on what's available on the 5th.
We should mention too, as well. People want to look at you, look at some of the things you do. Your Facebook page, your website, also great places to start too.
Yeah, our website is trippfamilymedicine.com, and the Facebook page is Tripp Family Medicine, and we really appreciate the patients that have made so many nice comments about what they see and how their experience is at our office. I just talked to a gentleman who's been around in, shall we say, industry in the Twin Falls area for a long time, and he said that his experience and his family's experience is just so dramatically different than where he's been elsewhere in the valley that anybody that asks him, what do you do, where do you go, that he always chooses our office. And I never try to claim that we're so much smarter, but you will feel more at home. You will enjoy the experience a whole lot more, and we are not perfect, so I don't want to claim that, but we absolutely do our best to make you feel like you're well taken care of.
The doctor's going to be talking about a potential crisis with sexually transmitted diseases following the break. I was going to say he was going to sing for us, but it's Tripp, not Von Tripp. But
Oh, yeah, not this year.
it's 48, and we're at 8:40 on Magic Valley this morning. Better Health with Tripp Family Medicine on News Radio 1310 KLIX and newsradio1310.com. And Bill Colley with you until 10 a.m. Dr. Jonathan Tripp in studio with us this morning on News Radio 1310 KLIX and newsradio1310.com. Magic Valley this morning with Bill Colley as well. Better Health with Tripp Family Medicine. And remember the slogan, life's too short not to feel good. Boy, today is one of those topics the doctor's going to talk about where
This is not the fun topic.
this is, years ago when I was a young man, I remember a friend of mine came by my house and I'd known him since kindergarten. Really nice guy and good family and all. And then he looked just ashen white and he slumped into a chair and he said to me, he burst into tears and said, "I have herpes."
Oh, yeah.
I'd never known anybody in my life at that point who'd ever had anything like this. And it was a complete shock to him, obviously, but to me as well. And so when it comes to sexually transmitted diseases, this is a battle I would think that this country has just seen this grow over the last few decades. And really, some of these things, I don't want to say they're out of control, but there's some serious health threats that are here.
They're very serious health threats. In fact, I've often commented to my staff that if I was in the dating scene, I know enough to be just absolutely scared to death. So, um, what we're talking about is sexually transmitted diseases that then, how you get them is unprotected sex. So, we're going to talk about how to protect yourself as well, how to, take care of that. And there's really only a couple things you really can do. One is abstinence. You just don't do it. You can't get it if you don't do it.
Right.
And the other is barrier protection, intercourse. And so this is a discussion that, if you got the 8-year-old at the radio right now, you might say, this is not the time to have you listen to the radio. But if you're 12, 13, 14, 15, it might be a perfect time to just listen and have a little bit of reality sent out as you think about teenagers. But this isn't just about teenagers. There are STD, sexually transmitted diseases, often referred to as STIs, sexually transmitted infections, um, that are epidemic proportions in our retirement communities. So this is not just about teenagers and people with loose moral values. This is really everybody. In fact, before I get into this is my comments are coming from a big summit conference, whatever you want to call it, that is an annual one about sexually transmitted diseases, how to prevent them, how to track them, how to treat them, and so I have some pretty significant statistics to talk about. But before I even get into that, let me just give a little overview. Sexually transmitted diseases range from things that can kill you, like HIV and even syphilis, to things that are inconvenient. Herpes, as devastating as that is and painful as it is, it doesn't kill anybody. Or, I guess there'd be some really rare person that had terribly immunocompromised system that, that could be the final death nail. But for most people, it's an annoying, recurring set of blisters and pain that you share with others if you're not using that kind of protection we're talking about. It's akin, it's the same virus, or at least a very similar virus that causes cold sores. So if somebody's had chickenpox, they could have shingles. If you've come into contact with somebody who's had an active cold sore, you get cold sores. I am a great example of this from about most of my life. I remember getting cold sores pretty regularly, but was that a sexually transmitted disease? Well, I hope not. I actually had shingles at age 9, which most
Ouch.
people, yeah, it's the worst pain in my life. So when I talk about herpes being inconvenient, it can be very painful, but it doesn't kill people. So we have others that can kill and maim in ways that ruin the ability of a woman to have children, have chronic pain, pelvic pain. For men, it can be chronic testicular pain, infections that are they'll change your life. They'll stop you in your tracks. So I, I want to talk about that from the point of view of there are some things that you can treat and get rid of, like we're going to talk about chlamydia and gonorrhea and even syphilis. And there are other things that once you get it, you don't get rid of it. Like what we used to talk about venereal warts, or it's called human papillomavirus. It is the cause of cervical cancer in women, and this is why we do pap smears, is because you get human papillomavirus and it causes ongoing changes, slow, chronic changes in the cervix, that the cells go from normal to precancer to cancerous. And it's not every type because there's many types of HPV, and we now have vaccines to help
The
prevent the
vaccine,
ones.
though, beforehand, right? You have to have
You
it
have to do
before.
it before. Yeah,
Right.
so if you don't have HPV or you don't have the ones that cause cancer, You can get a human papillomavirus vaccine that is now recommended starting at age 11 for boys and girls, not just girls. And so this is one that Centers for Disease Control are really trying to go after because here's the scary statistic. Almost 50%, that's almost half of the sexually active people, anyone, teenage adults, seniors, have HPV. You may not even see it. You may not know you have it. And so if you are having unprotected sex for the first time in your life with somebody, you got about a 50-50 chance you're going to contract HPV. That's a scary statistic.
Now, the others, even if you mentioned there's treatment for syphilis and gonorrhea and the like, but some of these things have become almost, they're a lot stronger than they used to be when it comes to a lot of the old treatments we used to use aren't very effective against them any longer.
That's a great statement because there are some of the, uh, like gonorrhea is one that people know from ages back. Gonorrhea is a very tricky bug. It's bacteria that has been able to change and evolve and basically fight off every antibiotic we've ever put up against it. So over time, the simple treatments no longer work. In fact, penicillin was the original, and it doesn't work at all. But we have switched over about the last decade or so to what's called dual therapy, meaning two antibiotics at once. And so far, those two together have kept it from mutating into something that can beat us. But we're really down to just a couple antibiotics left on that particular disease. So if it becomes resistant to those, we may have a sexually transmitted disease that is untreatable. So in other words, it will cause you trouble permanently and maybe kill you eventually. But let me talk about the three that are on the rise. Over the last 4 years, we have significant increases in three sexually transmitted diseases: syphilis, gonorrhea, and one called chlamydia. Um, these are tricky because chlamydia almost very rarely do you even know you have it. Guys get it and can carry it and not even have a clue that it's there. About the only symptom they'll have a lot of times is maybe a little bit of watery discharge, which is just, confused with maybe a little bit of leakage from the urine. So but it can be painful and it can harbor in the testicles or the tubes that come from the testicles and cause terrible, terrible pain and scarring and therefore further trouble and pain ongoing. For women, it can cause what's called pelvic inflammatory disease. And pelvic inflammatory disease is a scarring, well, the inflammation causes scarring of the fallopian tubes, which will make a woman not able to have children, not able to get pregnant. But it's not just the struggle with pregnancy. This is one that if you get the disease, it's like having a bad kidney infection. That disease can spread and actually threaten your life. So, pelvic inflammatory disease is painful, it's threatening to pregnancy and maybe to your life. So this is big stuff, but often goes undetected. So the recommendation is anybody sexually active should be checked for chlamydia on at least an annual basis. So this is a simple urine test for this particular one. It used to be among the meanest tests for guys. There's a swab that had to go up the urethra, and old nurses with a vendetta could torture any guy. But now it's just a pee in the cup, and we can test it. So it's really easy to do, and I'd really recommend it. If you've been married and nobody has had any other sexually active, no other sex partners for decades, you're probably not at risk. But if you say, oh, well, I've been with the same boyfriend for 3 months, that's not considered monogamous, and you're at risk. You're definitely at risk. So um, if you're sexually active, you probably ought to be checked for these things. Okay, so that's chlamydia. Gonorrhea usually has a discharge, especially for guys. They'll get a yellowish or almost even greenish discharge from the penis. It will become painful, and it is one, again, that is given us trouble with resistance to antibiotics. So it's a threat. So if if you have any symptoms like that, better get them checked out. And if you have a partner that doesn't know about it, they need to be told. So that's what our health department gets involved with, is making sure those contacts get made and that people get treated. Because Twin Falls is about 50,000 and Magic Valley has maybe 150 to 200,000. Unless you're leaving town all the time to go have sex, if somebody here has it, it's going to get spread farther and multiply. In fact, let me give you a great statistic. Okay, 2013. This is related to. Um, let's see. Is this my chlamydia? I'm just making sure I'm telling you the right one. Um, yeah, chlamydia. There's 1,700,000 cases in the U.S. in 2013
Those would be new
of
cases
chlamydia.
in just
Yeah,
1 year.
that's just 1 year. And in 2017, it's 2.3 million. So it is a 30% increase in 4 years. And the initial data for 2018 says it's going to be worse this year. So that's chlamydia. Um, Syphilis, there's an interesting one. For the older of our listeners, they'll remember a dictator in Africa named Idi Amin. And Idi Amin was a bloodthirsty warlord that just was absolutely crazy aggressive in the last years of his life. And turns out he died of syphilis. So he actually was crazy, but he had power. Mozart, I think, is attributed to have died from syphilis as well. So things, syphilis is really subtle. This is a hard one because if you get it, one of the only symptoms to begin with can be what's called a chancre, and a chancre is basically looks like a little abrasion that has a scab to it, and rarely does it have any pain with it, so people tend to ignore it. So you're thinking sexually transmitted. Well, it should be in the genital area, but you get a little scrape that looks like a scab, and you have no pain with it. You better get that checked out because it's easy to treat to begin with. It's simple. It's what penicillin became famous for. That's why it got the name the silver bullet, because it could treat syphilis. But syphilis for centuries had been an absolutely devastating disease that would make women infertile, but attacks nerves, attacks your brain, even joints, and so people would become crippled or and eventually kind of lose their mind and die from the effects on the brain. So syphilis is still around. What's interesting about syphilis is about 55% of the new cases each year actually are coming from sex from men to men. So I wouldn't say that it's for centuries has been a heterosexual problem, but it is more dominant in the homosexual population. So that's one to pay attention to if that's a concern. Um, let's see, and then gonorrhea. We talked about its resistance, um, but the total numbers. I told you one that was 1.7 million to 2.3 million. Uh, we had we went from the highest outbreak number for uh, chlamydia was in 2016. It was no, that was chlamydia. This is gonorrhea. Was 200,000. It broke the 200,000 mark nationwide in 1 year.
And that's probably the last year we have actually numbers for at this point.
No, they actually have 2017. I'm trying to find that so I can tell you the exact number, but it went up about 67% in 1 year. So you're going from 200,000 to about um, 312,000, I think was the number. So these are big changes. People are saying, oh, it doesn't matter. It's all taken care of. HIV isn't a big deal anymore. In the 90s when HIV came out, it kind of put a scare on everybody. Said, hey, protected sex is a better way because I don't want to die. Well, now HIV is pretty treatable, long term, very expensive, lots of devastating side effects from the medicines, but very few people die of HIV now. So it's been put on the back burner. People think it's not a big threat. But believe me, HIV is still a very big health devastation disease, and you catch all these others the same way. So
We've got to wrap up, but for people who'd like to, perhaps you're always looking for new patients.
Yep, and if you need to be tested for chlamydia and gonorrhea, we have an easy P test to do that. But we are at 208 933 4400. Oh, sorry, 4400 933 4400. And please call us if you want to be involved in the fun stuff, and that is the Peel Party or the Peel Seminar. And that's just this next week on Wednesday.
News is next. We want to thank Dr. Jonathan Tripp for dropping by today. It's 8:59 on News Radio 1310 KLIX.